Hi, thank you for coming to my poster presentation on getting connected experiential dementia training. My name is Marion Kyner. I'm a psychiatric clinical nurse specialist. I'm a certified dementia practitioner and certified positive approach to care trainer and coach. I'm passionate about changing the culture around dementia care. I'm passionate about working with families and patients that have dementia and helping them to live a life that's worth living. I have been a nurse a long time, and here recently I've worked in senior community for over 15 years. I worked at one care community for 14 years. I was a mental health provider. I was a dementia consultant as well as a trainer for the staff. When I first started doing this kind of work, I realized I didn't know a whole lot about dementia, despite the fact that I've been a nurse for a long time. And so I started taking classes, taking these certifications that I've gone through, certified, train the trainers, different ones. And so I was doing different trainings. I've been doing trainings with staff for over 10 years and love to do the training. And there's a lot of staff that really pick up on the information. But I also found that the staff just weren't carrying the skills with them out into practice, at least not enough. It wasn't changing how the way we were providing care. It wasn't changing how we were providing care. And so it just raised questions with me, and I realized that just giving awareness and knowledge for people is not enough to change care practices. In 2019, I participated in a geriatric scholars program with the Virginia Geriatric Education Center at VCU in Richmond, Virginia. And I did some research literature review on what makes an effective dementia training. And so then I developed my capstone project around that question. And that's what my poster is presenting, is some of my capstone project put into research. In 2021, I spoke with Dr. Kim Little at Longwood University Department of Nursing, and we talked about implementing this training with the nursing students at Longwood. One of the comments that she made that she has heard from the students was that they don't feel comfortable interacting with patients with dementia. So we thought this training on communication skills would be very beneficial for the students. So here's a picture of my poster, Getting Connected Experiential Dementia Skills Training. So I'm presenting what makes an effective dementia training and the impact, particularly on experiential learning in changing care practices in dementia. And this also raises the question of how do you measure effectiveness in trainings in changing practice. So this was an early research pilot study, kind of a quasi-experimental using pre-test and post-test, and looking at evaluating the impact of getting connected experiential training on students' knowledge and comfort level of interacting with patients with dementia. There were 50 nursing students enrolled in the mental health course at Longwood University. They all received the training, and they were asked to voluntarily participate in the study by signing a consent and then completing the pre-test, post-test, and the skill surveys. The objectives for the students were to learn communication skills in working with patients with dementia, to increase their comfort level in interacting and calming a patient with dementia, to recognize brain changes in vision, verbal changes in language, and changes in motor abilities. And the last thing was to be able to identify remaining abilities that patients with dementia have. Dementia is a healthcare crisis. 1 in 3 seniors dies of dementia. That's taken from the Alzheimer's Association facts and figures. Currently 6 million people in the United States have Alzheimer's disease, 50 million people worldwide. In less than 25 years, we're going to see 150 million people, almost triple the number of people worldwide that have Alzheimer's or other dementias. The culture around dementia care has to change, and it has to happen with nursing. Nothing has highlighted the need for change around dementia care than the COVID-19 and the myriad of tragedies that we've seen in nursing care facilities. But the lack of resources, short staffing, and overuse of psychiatric medications have been there long before COVID. Dementia care is a nursing priority. Dementia care is nursing care. It's not like we're not aware of the need for dementia training. It's just that it's not impacting the care that we're seeing. We know what works, person-centered care, non-pharmacological interventions, but what we're missing is we're not telling them how to do it. We tell them, focus on the patient, not on the task, and yet we teach tasks. Proficiency in any skills development requires practice and coaching. If you were trying to become a tennis player, if you just watched a video online, you would not be a tennis player. You need that training, you need that coaching. Dementia care, dementia training, people need to have that light bulb moment, that aha moment of what it's like to experience dementia and how to connect with people. They need to know that why. So what makes getting connected an effective dementia training? It's because it's all about the relationship. It's about becoming more aware of our own approach. This person has dementia. They can't change that. We can change. We can change how we approach them. So back to my poster and looking at some of the approaches that we have in here. In my literature review on what makes an effective dementia training, came up with a number of different effective approaches, and this training, particularly positive approach to care trainings, have all of those kind of effective training approaches. It also has communication skills and cue cards that the students use as they go through the training. The content in the training sessions, the content's not necessarily different in terms of content than other trainings. It's just how it's put together. It builds from that foundation of knowledge and understanding of brain changes to what a student can do, and especially focuses on communication and applying skills to be able to connect and build relationships with patients. The positive approach, this training, Getting Connected, was based on the positive approach to care model developed by Teepa Snow. She's an internationally known dementia specialist. And the information presented is done in an experiential way rather than a didactic way. It creates those aha moments. Here's a list of the effective training approaches that are in Getting Connected. So let me give you an experience. That's what really makes this training most effective, is that experiential. What do brain changes in dementia with language and vision, how does that affect communication? Well, we're a society of language and reasoning. We use language and words to communicate, and we use reasoning to get our point across. But starting even in early stages of dementia, brain changes that are occurring are happening in the language areas and vision areas. And yet, we're still using the same approaches of language and vision, language and reasoning to communicate, and it's not getting through. We're not communicating very well. And so we need to learn different approaches to connect and communicate with patients with dementia. So let's have this experience. I'm going to give you an instruction, and I want you to follow along. So pretend you have a piece of paper. If you have a piece of paper with you, go ahead and take that out. So I want you to take the paper. I want you to take fold it in half, and then take the top corner and fold it center. Take the other top and fold it as well. Take the new top, fold the center, take the other side and fold it along the line. Fold it in half, turn it over. Did you get it? Do you know what I was trying to give you instructions to do? Maybe you didn't hear me and I should give you more instructions because maybe you didn't hear it correctly and I have to speak louder. Well, I'm not going to go through that, but that's one of the experiences that we go through in our dementia training. And so we talk about, well, what happened? Okay, share that information. Share what happened for you. What was it like? Oftentimes the students say, well, I was confused. I was frustrated because I didn't get all the information. It made me feel stupid because I didn't know what I was supposed to be doing. They might be looking at their friend. They may give up. One student put it on her head and said, I'm done. We process, well, why did that happen? What happened and why did it happen? Well, I wasn't getting all the information. It felt like you were missing things. Oh, I was missing some words. I was. What if I told you that in early stages of dementia, patients in early stages are missing 1 in 4 words? Does it sound like that's what happened to you? In mid-stage dementia, people are missing 2 in 4 words. That's 50% of the content that is given. And yet we don't realize that they're not processing all of the information that we're saying. And so students have that experience, that aha, oh, that's what it's like to have dementia. And it creates that aha light bulb moment. And maybe they even connect with patients that they might have known or family members that they've had and seen these situations happen. So then we take it and we apply it. We apply new skills to that learning, and we practice those skills. So a skill in this situation, when somebody is not processing all the information they're given, is to use pause. And with pause, you say 3 words. You look for the head nodding, you look for the eye contact, you look for their response, and then you say 3 more. And during those pauses, you as the nurse are able to do critical thinking. You're assessing, how are they doing? Are they getting everything? Is there something else I'm noticing? So you're learning to have critical thinking, critical assessment skills, while you're also doing a skill that helps you connect better with a patient. So that's an experience of doing one of these cycles. And we do this cycle throughout the entire day. Everything we talk about goes into a cycle of an experience and what it was like and why did that happen and how does that relate to patients with dementia, and then what is the new skill? Now let's practice it. So they practice doing pause. The other thing that, again, is that they have these tools with them. They don't get any notebook. They do not get a binder. They don't take notes. They don't have to. They get cue cards, however. And on these cue cards are all of the skills that we practice. And we practice a lot, and it builds throughout the day. They have these cards. They can take them with them as students in their backpack to the clinical setting. As staff, they can take them and have them with them. So the cue cards are very helpful. And then the other part of the training is the coaching cycle. The coaching cycle is different. It's not telling them what they're doing wrong. It's asking them to evaluate themselves. So it gives ownership to the learner. It examines their approaches, asking them, well, what are you doing well? What's working? What part of that went well for you? And then asking them, well, what do you think you want to work on? What's not going so well? And let's try it. Let's practice that again. So we keep practicing and, again, building on it. We give each other feedback as well. Try something different. Try one of these skills that's on the card. So those are the different aspects of the training. Let me tell you a little bit about the study results. So we had 30 students completed the pre-test, 19 students completed the post-test, and then we had 11 complete pre- and post-tests. And of those 11, a mean score on the knowledge questions on the test, they went from a 65% to a 90%. So they really did learn a lot of knowledge in taking the class. In terms of their comfort level and evaluating self-perception of comfort, we had an unexpected finding here where their comfort level went down. And we weren't really sure about that. It wasn't a qualitative kind of question. It was just on a Likert scale. So what we think might have happened was that they got a lot of information throughout the day. They hadn't had a chance yet to apply it in a clinical setting, and so they may not have felt as comfortable. Measuring changes in care practices is difficult in the healthcare setting. It's very complex. There's multiple competing factors, including the person with dementia themselves, the staff prior knowledge and skills, their experience, as well as the environment. So it's just not as simple to evaluate. So future research plans I would do some changes in the evaluation levels and how I did the evaluation, do more qualitative questions and assessment, the surveys and the pre-test and post-test to simplify that a little bit better. And in the third level, in terms of evaluating their use of these skills, is in possibly going out to post-conferences after they've been in the clinical setting to do a post-conference and ask them how they're doing the skills. The strengths of this study was that it was solid training with an experienced trainer, and the students did gain knowledge. Limitations included too many questionnaires, pre-tests and post-tests and surveys, and they all weren't completed. So continuation of the study, currently we trained 68 more students at a sophomore level. They received the training in January and February of 2022. And now that was prior to them beginning their clinical rotation at a nursing home, learning fundamentals of nursing. We are now participating in post-conference sessions and discussion, asking them how they're building on these skills in the clinical setting. Some of the student comments already, because we're still collecting that data, some of the student comments have been, I feel more comfortable having had these training, and it shows them respect, seeing them more as a person. And the faculty will be looking at where is the most efficacious point in time to provide this kind of training for nursing students in nursing education. And so, my hope and desire is that I want to continue to offer these trainings. I want to build on some research in measuring effectiveness in the trainings and contribute to the body of knowledge of evidence-based practice in dementia training. I welcome feedback and questions related to the pilot study, to the model, or to any thoughts on incorporating experiential learning on dementia into nursing curriculum. Thank you.